Hello everybody, Dr. Bob Vaughn, your local health and wellness expert, and our health tip today is going to be about plantar fasciitis, which is foot or heel pain that a lot of people experience. So this is something that is part of our mission of making health simple, easy, and fun, and helping create a world that is free of chronic pain and chronic illness. One thing to know about plantar fasciitis is that it is actually responsible for over 1 million doctor visits a year. And the current treatments, I was just actually reviewing a study through the National Institute of Health, and they looked at injections, casted orthotics, as well as some different therapies, shockwave, ultrasound, cold laser. And what they found with those studies that they were all pretty kind of benign. They didn't really have any surefire, yes, this will help get rid of it, this will get it taken care of. Orthotics seemed to be beneficial for a week or so, according to the research. Injections, they weren't sure if it was the injection or the local anesthetic that helped out. And the ultrasound, shockwave, some of the cold laser treatments, things like that, had some kind of mixed reviews, more anecdotal research as opposed to more of the hard science as far as with the results with that. So the real question is, what do you do about it if you're dealing with this? If you're one of the people who is dealing with this foot pain from either running or other overuse issues, what do you do with it? So first, it's important to know some basic things. One, it's really important to make sure that you're actually treating the cause of a problem, not just the symptoms. So the foot pain is the symptom. The cause is going to be a combination of things that we'll discuss in a moment. First, some of the anatomy of it. So there's 26 bones in the foot or ankle. There's 33 joints in the foot or ankle. And there are over 100 muscles, ligaments, and tendons in each foot and ankle. So it's extremely important to make sure that those are all working properly. So one of the biggest things that we see is that there are weak muscles. So the intrinsic muscles, or the muscles that stabilize the foot and the arch, can be weak. When those muscles are weak, there's more stress put on the joints and the plantar fascia to help maintain the foot. So it's really important to make sure that those muscles are strong. So things you can do to help strengthen the muscles is you can work on your single-legged balance. You can try to pick things up with your toes, do towel scrunches, things like that to help strengthen the small muscles that kind of curl your foot up and stabilize your arch. One of the other things that we see are tight muscles. So the calf muscle, the big muscle on the back of your leg, a lot of times when that gets tight, it attaches to the calcaneus or the heel bone, and that will pull that calcaneus or heel bone backwards or posterior, which will pull and irritate the plantar fascia, which can put that undue stress on there. So making sure you're using like our kettlebell handle, calf workout and stretch, you're doing some stretching of that, making sure you're getting that rolled out. You can check out some of our other videos on that plantar fasciitis, the calf work as well. You can have a subluxated joint. So there's 33 joints in the foot, in the ankle, and they all have to move smoothly on each other. What a subluxation is when a joint stops moving properly. And that can lead to pain, inflammation, and eventually symptoms like plantar fasciitis. So it's important to make sure that you're getting checked for subluxation. Chiropractors are specifically trained to look for and treat subluxation to get those moving. Dehydration is a big issue that can affect it. When your muscles in your body are dehydrated, they crack and tear, leads to more scar tissue and inflammation, which are things that can cause plantar fasciitis. Plantar fasciitis is basically Latin for inflammation of the plantar fascia. That itis means inflammation, plantar means the bottom, and fascia means the fascial lining across the bottom of the foot. And the last thing you can look at is making sure you're having enough omega-3 fatty acids, which are going to come from your fish oil, specifically EPA and DHA, as well as enough vitamin D3. These are things, especially if you live where we live in Minnesota, only in June, July, and August can you make enough of it from the sun. The rest of the year, it's really important to make sure you're supplementing that. You should be getting anywhere from 2,000 to 2,500 milligrams of EPA and DHA a day, as well as about 1,000 IUs for every 25 to 40 pounds of body weight of vitamin D3 on a daily basis. So you can do the math and make sure you're getting enough of those. So if you or someone you know are dealing with plantar fasciitis, make sure you have them check out this video, follow through on a few of the things that we've talked about here as far as making sure you're rolling out and stretching the calf, getting your foot checked for subluxation, drinking plenty of water, working on those towel scrunches, marble picks up to work up on the strength, and make sure you're staying hydrated and getting those omega-3 fatty acids. I hope you found this video helpful. Again, we're on a mission to make health simple, easy, and fun, and help create a world that's free of chronic pain and chronic illness. So if you'd like to help us spread that, make sure you share, comment, share this with someone who needs it. We'd love the chance to help more people out. Have a fabulous day.